So next, we will talk about low or high immunity situation shows symptoms in liver and gallbladder system, or we can see in FG system. In this section, we will talk about two kinds of symptoms. The first kind of symptoms is shaking body. The second is blurred vision. When we talk about shaking body, many people can imagine or will remember the shaking body is connected with Parkinson's disease. Yes, Parkinson's disease people will have the shaking body. The shaking body it could be a confirmed symptoms to tell us that the patients have the LG blood low and fire excessive or fire toxin high to attack the body. This is the shaking body tell us. But for the shaking body, some people it's very serious. Some people is mild. Some people the shaking you cannot see. I will explain to you one by one. For the people who have the serious shaking, it's very easily to see because this kind of people they will shake always, cannot stop, except when they are sleeping. This is always people shaking. This is serious. Okay. Another kind of mild shaking, you need ask patient to take out his hands and fingers to hold it, and then you will see the finger is shaking. Generally, the normal people will have no shaking or will have very, very, very little shaking when they holding the fingers. They pull out the arms and the fingers. Okay, but the problems of shaking when they pull out the fingers. Okay, and hold it, it will show the apparent shaking. This kind of shaking, if you do not ask patients to pull out their hands, their fingers, you cannot see. So this is mild shaking. The other kind of shaking is not shaking body or shaking hands or shaking legs. No, it is shaking tongue. Okay, when you ask the patients to pull out their tongues cannot stay in one place, cannot stay in one situation. They always like shaking. Okay, this kind of shaking, it is called shaking tongue. Okay, it's called shaking tongue. This kind of shaking, it also shows the patients have fire toxin high, have the blood low, or have the water intake low. Okay, so do not forget these three kind of shakings: the serious shaking, the mild shaking, and the tongue shaking. Serious shaking everybody can see. Mild shaking only when you ask patients to take out their arms and hands and fingers and hold in one position, and then you can see. The tongue shaking only when you ask the patients to pull out their tongues, you can see. But all this kind of shaking will be related to fire toxin high or fire immunity excessive or allergy blood low or water immunity low. Anyway, water low, fire high. The shaking body will tell us this information. Blurred vision. If patients have chronic blood vision, generally it shows allergy blood low and the blood cannot replenish eyes to have better eyesight. If patients have acute blood vision, generally it shows hot toxin or hot Japanese toxin attacking the eyes.